Did you know that your skin can reveal surprising secrets about your health, especially when it comes to diabetes? That's right, that excess sugar in your blood may be leaving more visible marks than you imagine. Today, on Health Dose, we're delving into a fascinating and crucial topic: the top 10 signs of diabetes that manifest on the skin. Signs that often go unnoticed but are red flags from your body. And here's the question that can change your perception of health: do you recognize these signs? Stay tuned, because what we're about to reveal could be the first step in taking better care of your heart and overall health. Let's discover these unexpected signs together. But before we dive in, take a quick moment to subscribe to the channel by clicking the red button down here. The first subtle sign of diabetes on the skin, often overlooked, is acanthosis nigricans. This condition appears as areas of dark, velvety skin, commonly found in skin folds such as the back of the neck, armpits, or groin. What happens is that excess blood sugar triggers a chain reaction in the body, leading to abnormal growth of skin cells. This accelerated growth results in darker pigmentation and a distinct texture of the skin. While it may be mistaken for a simple hygiene issue, acanthosis nigricans is a clear sign that something more serious, such as insulin resistance, a common precursor to type 2 diabetes, may be occurring in the body. Therefore, when you notice such changes in your skin, it's important to consult a doctor for proper evaluation and guidance. The second notable sign of diabetes on the skin, which can be indicative of high blood sugar levels, is the presence of yellowish patches, especially around the eyelids. Known as xanthelasma, these patches are cholesterol deposits under the skin. Although xanthelasma can occur without diabetes, its presence in individuals with elevated blood sugar levels is more frequent and concerning. What happens is that the metabolic imbalance due to diabetes affects how the body processes fats, leading to the accumulation of cholesterol in specific areas, such as around the eyes. These patches are more than just an aesthetic issue; they are a visible sign that something more complex is happening in the body, such as problems with glucose and cholesterol control, both of which are risk factors for heart complications. Therefore, if you notice these yellowish patches, it's important to consult a doctor for a more detailed evaluation. The third noticeable sign of elevated blood sugar levels that may indicate diabetes manifests through frequent skin infections. In medicine, it is observed that excess glucose in the blood can compromise the immune system, making the skin more susceptible to infections. These infections can range from more common conditions like boils and fungal infections to more severe bacterial infections. Individuals with diabetes often experience slower healing of wounds or cuts, contributing to an increased risk of infection. The skin may exhibit red, warm, and painful areas, often with pus or other secretions. These infections, if not properly treated, can worsen rapidly, especially in diabetics. Furthermore, the constant presence of high blood sugar levels can cause changes in the skin, making it drier. Dry and cracked skin creates openings, providing an easy pathway for germs to enter and cause infections. Therefore, maintaining good skin hygiene and hydration is crucial to prevent these complications. The fourth sign of diabetes on the skin, associated with high blood sugar levels, is xerosis, also known as dry skin. From a medical perspective, chronic hyperglycemia, characteristic of diabetes, can lead to dehydration and changes in sweat glands, affecting the skin's natural moisture. As a result, individuals with diabetes often notice that their skin becomes dry, rough, and may flake. This condition is more common on the legs but can affect any area of the body. In addition to the discomfort and rough appearance, dry skin is concerning because it can lead to cracks and fissures, providing an entry point for bacteria and other pathogens, increasing the risk of infections. Excessive dryness can also cause intense itching, leading to scratching that can further worsen the skin condition and facilitate the development of secondary infections. It's important for people with diabetes to maintain a good skincare routine, including regular hydration and the use of gentle soaps, to minimize the effects of xerosis. The fifth sign of diabetes on the skin, related to high blood sugar levels, is the presence of diabetic dermopathy. This condition is characterized by the appearance of skin patches, usually on the shins. These patches have an oval or circular appearance, with a reddish-brown color and are often slightly raised or scaly. Diabetic dermopathy is considered one of the most common skin signs in patients with long-standing diabetes and arises due to changes in the small blood vessels that supply blood to the skin, a consequence of chronic hyperglycemia. While these blemishes may cause some aesthetic concern, they are usually painless and do not itch. They are not serious lesions, but their appearance serves as an indicator that blood glucose control may be inadequate. Monitoring these skin changes and consulting a doctor, especially if the spots change in appearance or multiply, is essential. The treatment for diabetic dermopathy primarily focuses on proper diabetes control, and the lesions may decrease with improved glycemic control. The sixth sign of diabetes on the skin, associated with high blood sugar levels, is the formation of diabetic blisters, also known as bullosis diabeticorum. This rare phenomenon manifests as painless blisters, similar to burns. These blisters can appear suddenly and are more common on the lower limbs, such as the feet and legs, but can also occur on the hands and forearms. Diabetic blisters vary in size and are often filled with clear or yellowish fluid. While the exact cause of these blisters is not fully understood, it is believed that changes in skin structure and small blood vessels due to high glucose levels play a significant role. These blisters tend to heal without the need for intensive treatment, as long as the blister's integrity is maintained, and the area is kept clean to prevent infections. It is crucial for diabetes patients to carefully monitor any changes in their skin, including the appearance of blisters, and consult a healthcare professional to assess proper glucose control and discuss appropriate preventive measures.
If what I shared so far has resonated with you, I have something special that will interest you. Don't miss the opportunity to transform your life and start living your healthiest self today. By acquiring the ebook Secrets to Unshakable Health, you will have a guide with practical and proven strategies for living a longer, disease-free life. Click on the link in the first pinned comment and discover the path to lasting and robust health.
The seventh sign of diabetes on the skin, stemming from high blood sugar levels, is necrobiosis lipoidica. This rare condition is characterized by the appearance of thick, reddish patches that over time turn yellowish and waxy in texture. Typically, these lesions occur on the legs and are more common in women. Necrobiosis lipoidica is associated with changes in blood vessels and inflammation in the layer of fat beneath the skin. Although the exact cause is still not completely understood, it is often related to diabetes and inadequate control of blood glucose levels. Necrobiosis lipoidica lesions may be painless but are susceptible to wounds and infections. In some cases, they can cause itching or discomfort. If the lesions break open, they can lead to hard-to-heal ulcers. Treatment for this condition focuses on effective diabetes control, and in some cases, topical medications or injections may be used to reduce inflammation. It is essential for patients with these lesions to consult a dermatologist or a diabetes specialist for proper treatment and to prevent complications. The eighth sign of diabetes on the skin, related to high blood sugar levels, is the frequent occurrence of fungal infections. Among the most common is cutaneous candidiasis, caused by the fungus Candida albicans. This type of infection is particularly prevalent in areas of the body where the skin is warmer and moister, such as skin folds, under the breasts, and between the fingers and toes. Typical symptoms include red patches, often accompanied by itching, burning, and sometimes small blisters or pustules. Fungal infections are more common in people with diabetes due to the excess sugar in the blood, which creates a conducive environment for fungal growth. Additionally, changes in the immune system associated with diabetes can hinder the body's ability to fight these infections. The usual treatment for fungal infections in diabetic patients includes topical or oral antifungal medications, depending on the severity of the infection. It is crucial to maintain good blood sugar control and proper hygiene to prevent the onset of these infections and to assist in faster treatment and recovery. The ninth sign of diabetes on the skin, due to high blood sugar levels, is the emergence of diabetic sclerodema. This rare condition is characterized by the thickening and hardening of the skin, mainly affecting the neck, shoulders, and back area. The skin in these areas becomes thick, with a waxy texture and may have a reddish or tan coloration. Diabetic sclerodema is directly associated with inadequate diabetes control, especially in cases of long-standing type 2 diabetes. The condition not only alters the appearance of the skin but can also restrict movement due to the hardening and thickening. Although it is painless, it can cause discomfort and limitation in the mobility of the affected areas. Treatment for diabetic sclerodema primarily involves strict blood sugar control, along with therapies to improve skin elasticity, such as physical therapy, and, in some cases, medications that help reduce inflammation and skin thickness. Evaluation by a dermatologist or an endocrinologist is essential for a correct diagnosis and to establish the most appropriate treatment plan. The 10th sign of diabetes on the skin, related to high blood sugar levels, is the onset of vitiligo. Vitiligo is a condition in which the skin loses its pigmentation, resulting in white patches that can appear anywhere on the body. While vitiligo can affect anyone, it is most commonly observed in individuals with type 1 diabetes, an autoimmune disease. This occurs because the immune system, which normally fights infections, mistakenly attacks the cells that produce melanin, the pigment that gives color to the skin. This association between vitiligo and type 1 diabetes makes the presence of white patches on the skin a potential sign of diabetes, especially when accompanied by other typical symptoms of the disease. The treatment of vitiligo involves stabilizing the depigmentation process and may include topical therapies, phototherapy, and in some cases, surgery. Although treatment can help improve the appearance of the skin, it does not cure the underlying condition. Furthermore, it is crucial for patients with diabetes and vitiligo to maintain strict blood sugar control and regularly monitor their condition with a healthcare professional. Understanding that vitiligo can be an indicator of an underlying autoimmune issue, such as type 1 diabetes, is important for proper diagnosis and management of the disease. And thus, we come to the end of another video here on Health Dose, where we explored the top 10 signs of diabetes on the skin. Today, we learned how excess sugar in the blood can manifest in different ways on our skin, from acanthosis nigricans to vitiligo. These signs include changes such as spots, infections, dryness, and even blisters, all important reflections that our body gives about our internal health. We remind you that while these signs are indicative of diabetes, they are not exclusive to this condition, and a medical consultation is essential for an accurate diagnosis and effective treatment. Awareness of these signs is a crucial step in taking care of our health, especially in such a prevalent and serious disease like diabetes. If you found this video informative, don't forget to leave your like and share it with friends and family. This is a simple way to help others stay attentive to their health. And if you're not subscribed to the channel yet, subscribe now for more content like this. Here on Health Dose, we remain committed to bringing valuable information to help you maintain a healthy heart and a healthier life. Thank you very much for watching, and until the next video.